here in our great city. I know for one that we are all really happy to be able to do this tonight and have people be able to ask their questions. As we all know, the news and guidelines and everything is changing just really, really quickly. And I think it's really important that we take a minute to just kind of stop and get informed and ask questions so that we know the best ways to move forward as a city and as families and as individuals. So we are really, really fortunate to have some great resources here in our city, and we've assembled some of them for you tonight to ask your questions. First of all, if my panelists can just wave when I say your name so people know if they're watching who they're talking to. First of all, Dr. David Cohn, who is the Chief Medical Officer at the James Hospital and Solov Research Institute at The Ohio State University. Also joining us tonight is Dr. Abigail Norris Turner, who is an infectious diseases epidemiologist and an associate professor also at The Ohio State University. Joining us as well is Dr. Beth Weinstock, who is a primary care physician at Equitas Health. And then I'm going to kind of chuckle when I introduce Dr. Michael Weinstein, because he had about 43 titles, and it would take the whole hour to say them all. So let's just say that he is the resident expert in emergency medical care. So you can ask your questions to him. Also, of course, we have our mayor who can speak to us, Mayor Ben Kessler, who can talk to us tonight about what the city is doing, our responses and resources that we have here as a city to offer. So with no further ado, I'm going to hand this over now to Dr. Mike Weinstock. If I said Weinstein earlier, I apologize. We have a friend who's Dr. Weinstein. So I was hoping that I wouldn't get that confused, and I think I may have. So Dr. Weinstock. I'm going to hand it over to you to give us some background on the virus and COVID-19, and we'll go from there. So thanks so much.
Sure. Thanks so much, Jen, for organizing this and everyone for being a part of it. I have just about a 3 or 4 minute thing I was going to throw together. It's a lot of stuff that we all really know already. And in the sort of month that we've gone through, the longest month of all of our lives, March, if you could think of how things were at the beginning of this month, was completely different. There were campaign rallies and we were getting together with friends and going out to restaurants. And we had at that time thought that this was a disease that was isolated to a different country and also to predominantly older patients and older people. And unfortunately, we have found that not only is it, unfortunately, it's something that occurs so commonly in that population, but can strike really anyone. And there are children, adolescents, middle-aged people who are unfortunately having complications from COVID. And it's a novel virus. In other words, it's something that we haven't been exposed to. And because of that, it strikes each person differently. And some people have minimal symptoms, as we all have heard about, but that's pretty rare to have just maybe minimal symptoms or loss of sense or taste or smell. Most people do have, and I know Beth and I speaking about things have seen people with severe shortness of breath and chest pain, that type of stuff. The problem is there's nothing really at this point to do until you get to a severe stage when you would need oxygen, or hopefully when you would need endotracheal intubation down a ventilator. So it's struck in just about every country. These statistics are from the Johns Hopkins site, just from earlier today. The United States, almost 200,000 cases now, almost 1 million cases around the world. And the deaths, and if you look at the total number of deaths, 41,000, but go down to the bottom, that 932 number, that's number just for New York City. So that's just one city in America that has that many deaths, unfortunately. And when you think about the different type of viruses that can strike us, and we all hopefully get vaccinated against the flu, and a lot of people get the flu, and there's a fair amount of mortality, but a lot has been made of how this is different than the flu. And there's many reasons, of course, the infectivity, the point that is a novel virus, but also the fact that the mortality is a lot higher. And we think that it's somewhere between 10 and even 20 or even more percentage points higher than the flu. And it's striking people who are young and healthy. And so that's one reason why it's tough. The other reason is because it's striking so many people at the same time, and it's just really completely overrunning our hospital systems. And in fact, a lot of hospital systems have called on their primary care physicians. Are you able to work in an emergency room if all of the emergency physicians go down? Are you able to do these other things, even to the point of managing ventilators? And, we don't really know where this thing is going, but we do know that a lot of places that have preceded us by 2 or 3 weeks, Italy, Spain, and China too, have seen a very, very high number of healthcare workers become sick and even unfortunately expire from this. Symptoms can really be anything. And we say at this point, it doesn't really matter that much, because if you have the flu or a cold or you have COVID-19, well, you don't really do anything until you get to that point. So even if you go to the emergency department with some of these symptoms, if your oxygen level is adequate, if your heart rate is adequate, we're still going to reassure you, hopefully. We're going to have you use acetaminophen. We're going to have you self-quarantine for 14 days. And Abby and I were speaking just earlier, and there are some tests that are coming hopefully very, very quickly, but at this point it still takes a fairly prolonged period of time. And because of the lack of tests for patients and for all of us who might have some of these symptoms we don't really know, there's really not much more to do now beyond just our own sort of self-quarantine and try to prevent this from being caught by others. And so Abby, one thing I'd be interested in hearing you talk a little about is that this R naught, the R with little O under it there. And I know if it's less than 1, it sort of dies out. And if it's greater than 1, it continues. And so it was sort of funny. We, in a bad parenting move, Beth and I watched the movie Contagion with our kids. And they were talking about things that anyone at the time seeing that movie would be complex types of things. And they're all telling me like, who's coughing in their hands and what the R naught is. And they know this stuff now, which is unfortunate and tragic that anyone that's, a teenager or a middle schooler would have to know these kind of things. But at any rate, that's sort of the end of this little presentation. This is for all of us what we think about when we're wondering if we should call the squad and go to the emergency department. And we're sort of balancing those things out because we don't want to wait too long. On the other hand, we don't want to go to the emergency department and expose ourselves to germs and to risk. And in addition, it seems like in the emergency departments, all we're seeing is COVID, but there are still heart attacks and strokes and all these other things that are happening. So there's a lot of interplay between the symptoms. So for example, of course, if you have a history of heart disease and you're 70 years old and you have crushing chest pain with sweating and shortness of breath, you should go to the emergency department for that. On the other hand, if you have a fever and a cough and it's a dry cough and you're just exposed to someone with COVID and then you get chest pain with that also, that doesn't mean you're not having a heart attack, but it just makes it a lot less likely. And so it's tough and there's not really a great answer. So maybe our panelists could sort of speak to that a little bit, but we don't want to overwhelm the emergency department. On the other hand, we don't really want to wait too long if we have those severe symptoms. So that's what that sort of scream type of image was and decision as far as calling. So these are more some clinical signs and some things that we use to actually make the diagnosis with lack of immediate testing, and hopefully some of that's closer on the horizon. But that's just a little overview. I think a lot of us know most of that stuff, but hopefully it frames things just a little bit for some of the questions, because this is tough for people in the community. Is it safe to go to the grocery store? And of course, we have to eat. Is it safe to be around your children? Is it something that we should go with minimal symptoms, maximum symptoms, or if we have other symptoms that aren't even related to COVID, probably because we don't have some of those things. So these are tough questions, and they're going to be difficult things that oftentimes we're going to need to make a decision in conjunction with the primary care physician. But hopefully this session will get us a little bit further with answering some of those questions and trying to shed some of the, hopefully, expertise that we all have. Ben, you have some pretty good information as far as the response. I mean, Bexley has been really out front of this with service to our residents, with information, website information also, as far as what we're able to share with them. So would you mind sharing some of that stuff that you and the City Council and the City of Bexley has done to help our community? Unmute. I'll do it.
Thank you, Dr. Weinstock. Am I good now?
Yes.
There we go.
Yes.
So
I don't want to miss even 1 second of what you have to say, Ben.
Just hang on these words because they're golden.
Yes. Yes.
So we've assembled a lot of information at our website, bexley.org/coronavirus. And I want to go over a little bit what we've experienced in the city of Bexley and what we're kind of seeing out in the community and what we've been learning as we've been working with our own Bexley COVID-19 panel. So Bexley currently has 8 confirmed cases. And when I say currently, what that means is not that there are necessarily 8 active cases, but there have been a total of 8 confirmed cases since testing has begun in the US and in our region. In fact, this number increased greatly today. There was a whole slew of new test results released by Franklin County Public Health. Prior to that, we had 3, and all 3 of those cases had been confirmed and then cleared since then. So for a brief period of time, we thought that we didn't have any active cases in Bexley. Obviously, we were wrong, and that kind of is an important message to get across. That over the next few weeks, we're really going to be, as we talk about this and as you read in the news, we as a country are going to be approaching that peak of that curve that we're trying to all decrease the curve and lengthen the curve, but still we're going to be going through that peak. And even though it might seem like you don't see a whole lot of this happening in our community, it is a pretty, it is at times invisible. It is at times not easy for us to see. And it's really important, especially as the weather gets warm, especially as we all get stir crazy in our houses, to double down on our efforts to contain the virus by practicing really cautious, extreme social distancing measures, following all the orders to stay at home. Bexley's orders are very similar to the state's. We've actually just kind of piggybacked off of that. We have some detail about that. If you go down on our website, I actually think this is on the wrong page, but if the front page of coronavirus, as you can see, there's a lot of information on here. We have guidelines on when to self-quarantine. We have some parenting guidelines because it can be pretty difficult to know how to advise our kids and how to make sure that our kids are safe, they're practicing really safe practices when they want to go talk to friends and hang out with friends. And we have an overview of our key guidelines. As you've seen, playgrounds in Bexley are closed. That was actually then backed up by a state order. Our police officers are enabled to break up groups of more than 10 if they feel that they are posing a threat to public health. And other than that, what we're doing is we're enforcing the guidelines that are in the orders that are given from the state. The state has showed such excellent leadership, due in part to 2 of our residents, Governor Mike DeWine, but also our own rock star Amy Acton, who is the head of the Ohio Department of Health. So keep an eye on bexley.org/coronavirus. The other thing I really want to draw attention to is that we've been giving care packages to residents who are under self-quarantine as we find out, and also trying to figure out ways to connect volunteers to needs that are in the community. So you may have seen, if you're on this call, you're probably tied into social media. So you've probably seen our needs survey and our volunteer survey. The needs survey covers residents who are in need, whether or not they're quarantined. They might just be at a vulnerable population that needs some assistance, or maybe financially vulnerable. And we're connecting them with volunteers. So you can, oh gosh, that's not going to work. Don't look at that. So you can fill out our volunteer survey so that we can know how you can help. And you can fill out our needs survey so that we know what the needs are. And you'll notice in your water bill, sorry about the water bill, but that is about to come out. There is a paper version of that form for those of us who don't maybe use computers as much. That's going to be a really important tool in the coming weeks for us to be able to connect residents who have needs with residents who are able to help fill those needs. And I want to give a huge shout out to DARN, which is Developmental Assets Resource Network. DARN has been connecting food with families who are in need right now, and they're going to continue to work with members of our community, and we're partnering with them in order to help expand that program and to find ways that we can help fill those needs. So that's where we are today, and it is a rapidly evolving public health crisis, and we're here trying to help out in any way that we possibly can. One thing I haven't mentioned is that one of our obviously key responsibilities through this is maintaining our city services, and we've put a whole lot of things in place to make sure that we are meeting all the needs of our citizens and be able to maintain those key city services throughout this crisis.
Well, then certainly it makes us proud to be residents of Bexley, without a doubt, and have you as our leader, and folks like Jen and the City Council helping out too. To be really clear, if someone does want to volunteer, Bexley.org, and then what do they click on from there? Or will it be very obvious for volunteers?
No, it's a great question, because actually, because we've had so much news, that article has fallen kind of near the bottom. Right now, I'm going to put it up at the top of our coronavirus page so that people can volunteer via that link.
Okay, and so specifically they'll type in bexley.org/
/coronavirus, or
Okay.
there's a big banner on our front page. It'll be hard to miss. I'll put it on both places just to be careful.
So Beth, you obviously are doing primary care. You're seeing people who have symptoms as well as who have a lot of questions about things. The first question here is probably the most important thing that all of us is on our mind in our own self-interest, because we eat 3 times a day, and it's grocery shopping and cleaning groceries once they get home. I know you and I spoke about this last night, but in the surface, it sounds pretty scary. It's not quite as scary when you get more into it as it would otherwise seem.
Hi, everybody. So this is definitely on everybody's minds, and it's a scary thought that the food coming into your house could be contaminated with something that can make you so sick. To date, there's no documented case of corona being passed from a package of food from a grocery store. That includes fresh produce. It includes boxes of cereal or cans. So as far as we know, there's not been a documented case of corona coming from groceries. I'm fairly certain there's been documented cases of coronavirus coming from other grocery shoppers. So people that you're near in the grocery store could pass coronavirus fairly easily to you through respiratory droplets. But they're not really recommended that you have to bleach everything when it comes into the house. They're not really saying that you have to wipe down every surface of everything you buy. If you wanted to be ultra cautious, of course, you could take a wipe and wipe off the surfaces of whatever you've bought. There's not going to be any harm in that. I think there could be some harm if people were trying to wash produce in some sort of toxic chemical. But to try to have a semblance of a normal life, I would suggest everybody not worry as much about groceries coming into your house. The more important thing would be to wash the cart when you're shopping, to stay at least 6 to 10 feet away from everybody in the grocery store, and to Purell or wash as soon as you get home or as soon as you leave the grocery store. I've actually been wearing some just standard cotton gloves when I go to the grocery store, and then I peel them off when I leave and I throw them in the washing machine. It may be doing nothing, and then I don't try not to touch my face. But I don't think we need to be worried about the food that we're putting in our mouths or into our pantries.
That's definitely reassuring, because that's super scary to think about catching it in that sort of way. Abby, I had sort of mentioned that this R naught number, and it sort of speaks to a little bit further down the road, like when this thing might go away. I mean, the flu sort of goes away every year and comes back again. I mean, your specialty at Ohio State is epidemiology. You know, where are we at as far as, I know we're sort of still climbing the curve, but what can we sort of expect looking forward?
Yeah, thank you. So there's a lot of smaller questions packed in your one question. So let me take them a bit at a time. So to answer the first one, when you asked about R naught, which is the reproductive number, so that refers to the idea of how many people on average an infected person will go on to infect. So the R naught, separate from any intervention, this doesn't include social distancing or any future vaccine, just the biological reality of R naught for coronavirus seems to be somewhere between 2 and 3. So without any intervention, just operating in normal life, an infected case would go on to infect 2 or 3 other people. And then the chain of transmission would continue. So all the interventions that we're doing are to drop that reproductive number, the R naught, below 1. So the epidemic will burn out if the R naught becomes less than 1, and it will continue if R naught stays above 1. So where are we right now? Well, due to everybody's great efforts, and Ohio has been really a leader on this, we have effectively pushed out the surge of cases the peak of the cases that we'll see in the state. I was looking at some modeling estimates today from Ohio State, which showed that had we done nothing, like starting around the time of the Arnold, we would be in a position now of tens of thousands of cases in the state. And instead, we've really flattened that out to a much lower number. And now our peak is expected, again, sort of barring additional interventions, our peak is expected to come in the beginning of May. And that could change again, and it will change again, because those are all based on models, and models are only as good as the data we put into them. And as we get better data, the model will continue to be refined. So right now, early May is when we see the peak. Now, that doesn't mean that the cases won't keep climbing until May. Of course they will, but the real peak will happen potentially in early May. You had another question. I didn't cover it.
When will it be over?
Oh yeah, and also about seasonality, I think was the other question that you had about will we see patterns with coronavirus the way that we see for flu? And really the answer to this is that we don't know. Everybody is hopeful that cases will drop in the summer the way that we see for flu. But this is really different because no one is immune yet to coronavirus. And so seasonal patterns tend to take shape when you have a proportion of the population that's already immune to infection, that's already experienced infection. Right now, we don't have that. So we don't really have a way to build in, or we're starting to have more and more people who have recovered, but in general, the whole population is susceptible right now. And that really drives a lot of the patterns we see around seasonality. Other things that may matter, the humidity in the air, the temperature, the amount of light in the day, UV exposure, all these things probably matter for survival of the virus and for transmissibility and for seasonality. And we're hopeful they all point in the right sort of suppressive protective direction come summer, but there is not data yet to support that.
Thank you so much. That's interesting and scary, obviously, information. So I have one more. Dave Cohn, you are the Chief Medical Officer of the James Cancer Center at Ohio State. Also do a lot of work with other parts of Ohio State University, emergency department, et cetera. So worst case scenario, one of us gets this, we have a progression of symptoms, we're severely short of breath. What can we expect when we go to the emergency department at Ohio State? They have tents where they screen us. Are there separate wards, hot and cold zones? What is OSU doing to respond to this crisis?
Yeah, so thanks for putting this together, Jen and Mayor. This is an incredible opportunity, I think, to have an open conversation with the community. Michael, I think that what I would say first and foremost is if you have symptoms, I think that the overall goal, as you mentioned earlier, is not to go to the emergency department unless you really need to. And the reason for that is that most of the times if somebody is infected with coronavirus, they end up getting better by themselves. And so for mild symptoms, if you've got upper respiratory symptoms and cough and a low-grade temperature, the best thing to do is the things that the city of Bexley has discussed, which is stay at home, take care of yourself, and make sure that you're not in contact with others so that reproductive, the R naught, doesn't lead to infecting other individuals. But if someone's ill enough to come in to be evaluated, I think, the first step is if you're not critically ill or emergently ill, you reach out to your, physician, your providers, and you get in touch with them about whether or not testing is appropriate for coronavirus. And then from there, if you need to be in the hospital, that's when a lot of the work that we've done at Ohio State and all the hospitals around the state and the country and the world have prepared for. I think that, as Abby said, the longer that this plays out, meaning that if you've gone from having 10,000 cases, what we would have had today had we not done the things that we did a month ago, to 2,000 cases today, then our hospital systems would be overwhelmed. So we've had this lead time to be able to prepare. And so the preparation includes, what do you do when someone comes in? You want to make sure that you isolate them so they're not infecting other healthcare workers or other individual patients. You get them evaluated and managed quickly. We've been fortunate to have now developed testing in the hospital itself to be able to turn around the testing really quickly. There's a lot of stuff, as you mentioned, Michael, besides coronavirus. Influenza season is still today. And so we have rapid testing to make sure that the individuals that come in either do or do not have coronavirus, and that helps to identify the next opportunities. And I think that, the message that I would send is that when you look in the media and you look to New York and you look to Italy and you look around the world, there's a lot of panic that's going on. The comment that I would make is that it is actually unbelievably calm in the health systems right now because we've done all these preparations. We're thinking about what happens next, and we're not in any way overwhelmed. And the hope is that with the length of time to prepare before this peak, we'll still have the opportunity to do the right thing and to do it in a scale that's able to accommodate the entire population.
So I know, Dave, you are going to what, like one meeting a day now? Is that right?
One meeting a day? That's about right. Half hour a day.
So thank you.
It's been, it really has consumed the work life of many individuals. And again, I think that the remarkable thing is just the team effort. And what I hear, you know, and Governor DeWine and Dr. Acton speak about this on a regular basis, this alignment of hospital systems around Columbus and around Ohio as well. These are groups that, you know, historically have not talked to each other. They've been in competition, but now everyone's coming together, recognizing that this is, it's not an Ohio State problem. It's not a Ohio health problem. It's a community problem. And so we're all banding together with our private partners at Patel, as you've heard about, for doing things that are really innovative, just to make sure that we're taking care of the entire population.
Well, Dave, I mean, with the like spare, you know, 5 minutes of your life that you have every week, I'm sure we all so appreciate you being on this call and you know, sharing what OSU is doing and the expertise that you have. So that's awesome. I wanted to sort of expand on just something you talked about before, and I had alluded to a little bit also, as like when to go. So Beth, I'm going to ask you a question that I know there's not really a pure answer for, but I'm sure it's something that's on everybody's minds is if you do have a cough, a dry cough, fever, you know, even some shortness of breath or some chest pain, when do you decide to sort of bite the bullet and go to try to get tested either with a primary care physician, urgent care, or emergency care? And when do you say, I should just wait at home a little bit longer because it's too risky to go? How does the lay non-medical person balance those two possible pathways?
Well, that's been the question for me and my coworkers that it's come up so many times in the last 2 weeks. We're doing telehealth visits and we're doing telemedicine visits, and so many of those calls are about this question. You know, I have A, B, and C symptoms. When do I go? What do I do? And what we're trying to do, as hard as it is to try to make an assessment over the phone based on, I mean, it sounds primitive, but you know, how comfortable a person is speaking in full sentences. Do they sound short of breath? Are they eating and drinking normally? Can they stay hydrated? And also, what are their other conditions? Are they high risk or low risk? A lot of my patients are probably higher risk because we see a lot of patients with HIV and other illnesses. However, most of the time their HIV is well controlled. So we put them in sort of the middle ground and we just base it on their symptoms. And the triage system that we've set up is involving our whole team, and it involves lots of phone calls to that patient. You know, we're following them several times a day, sometimes if we're worried about them. And to date, I can't speak for my colleagues, but to date, I've only had to send 2 people over to the hospital. And that's after we tried supportive measures, a couple times, you know, adding in an inhaler to help them with their shortness of breath. And when they finally say, I'm not improving or I'm getting worse, then it's time to go. But I think that agreement revolves only around the idea that you have a primary care physician and that you have someone you can talk to. And unfortunately, in our current medical system, not everyone has that luxury. So if we were to speak out to anything on this, I would say that for people who don't have a primary care physician, I would say to start making some phone calls and get established with someone, which I don't think at this point would be an impossible thing to do, but then at least you would have this touchstone, someone who could talk you through your symptoms.
I know it's sort of an unfair question because there's really no perfect answer for that, but yeah, you know, involving medical expertise obviously seems like the super smart way to go. I'm going to just throw out 2 questions. And if folks that are listening want to type in, there's a little icon. If you hover your your mouse and wiggle it around, little icon for questions and answers. And so anybody that's interested in fielding these, number one, will running items through the dishwasher kill the coronavirus? And two, once you have it, are you susceptible to getting it again? Abby.
So the answer to the first question, will running something through the dishwasher kill the coronavirus, is an unequivocal yes, if you put soap in your dishwasher, which hopefully you do. But let me say something else very important, which is soap kills coronavirus, and it does not have to be special soap. It doesn't have to be antibacterial soap. It just has to be soap. The sort of the way the virus is built means that soap interacting with the viral layer, with the outer membrane, dissolves it. So it is inactivated if you wash for 20 seconds and get a good lather with soap on your hands or on your dishes or anywhere else. So there's no more hand sanitizer left in the stores, but that's fine because soap is actually better than hand sanitizer. So only use hand sanitizer or wipes when you're out and about. You can kill coronavirus with anything that has more than 60% alcohol in it, or with a bleach solution, but really soap is the easiest and most effective way in your households to manage coronavirus, the most sustainable way to not go through a lot of supplies. And you have loads and loads of it around your house. So the second question was about reinfection. And so this is super, super interesting for epidemiologists, thinking about those models I talked a minute ago about trying to figure out what the curves will look like going forward. And there's real debate at this moment about reinfection and what's possible. So there are a lot of anecdotal reports, or a handful of anecdotal reports, of people who have been infected and healed, and then they have come back and been reinfected. But there is also evidence from animal models and others that suggest that once you have coronavirus, you have a period of at least short-term reduced risk of reinfection, or immunity is what people might say in a more medical setting. It's not clear at all how long that will last, but it is unlikely that most people who are reinfected will go on to be, who are infected will go on to be reinfected shortly thereafter. It most likely includes some period of reduced likelihood of reinfection. So we will know a lot more about that in the coming months. But the sort of take home answer is be optimistic, but that we really don't know yet. I'd be curious if my clinical colleagues here agree, but that is my understanding of the data.
Yeah. I mean, I could speak just the hand washing, exactly the same thing. We're sort of hoarding our Purell, the amount that we have left for cell phones or washing when you're in the car and all. But when we're home, we told everyone, the kids, just use soap and water because it's better, and we have plenty of soap and plenty of water. So that's an easy way to go. Dave, I was just sort of thinking when Abby was talking here, is that a maybe younger person or middle-aged person who's healthy is one type of person who obviously has a risk, but you are a gynecologic oncologist and you have patients who are immunosuppressed. Their immune system is challenged based on either chemotherapy or because of an underlying cancer. Should those people manage things differently? Can they see kids or grandkids if they're living with someone in a home, which most people are? How should they interact with people? Is there a high risk for them just walking around the block with the dog? I mean, how should they act? It's super scary for us, and it's even more scary for people in that demographic.
Yeah, and I think that, Michael, you pointed out the exact correct point, which is that it is really scary to have underlying conditions, whether it's cancer or lung disease. This isn't just cancer, this is solid organ transplant. It is chronic lung disease as well. And so there's a lot of people that have a lot of fear about what the impact of coronavirus could be on them because of their underlying condition. And it's really fascinating because I think historically the original reports that were coming out of China were that this is a group of the virus affected groups in the older age area way more than the younger group. But when Dr. Acton presents the information, she comments regularly that the average age is 52 or 53. And so it's not necessarily that after the age of 60, that's when the risk occurs, because half the people are, less than 52 and half the people are older than 52. The range she gave today was age of less than 1 to the age of 99 in the state of Ohio about who's been affected. So age is not a primary factor to predict what the outcome is going to be from coronavirus or who gets it as well. So it gets back to the same idea, which is that everybody's got an individual risk for, infection with COVID-19. We can all do our part to minimize the chance that we ourselves will become infected. And that's hand washing, it's hand sanitizer, it's staying away from individuals who are sick. If you yourself are sick, you need to be home because, again, that's the risk you're going to infect other people. And while I think the clinicians sound like broken records when we say the same thing over and over again, there's a reason for it. It really does make a difference. But for those individuals that have cancer, there is an increased chance of having a bad outcome from coronavirus. And that just means you do have to be extra careful. But that doesn't mean you can't be walking the dog. It doesn't mean you can't go around the block. It doesn't mean you can't be with your grandchildren or your children. But it means if they're ill, then it's their responsibility to make sure that they're away from individuals that could become very sick with COVID-19. And I think that's where that extra responsibility really lies, is to make sure that that social distancing, even within families, is instituted in the individuals that are at highest risk if there is a concern of somebody being infected either with influenza or with COVID-19 as well.
Yeah, that's good. I mean, it's actually honestly good to know, especially with spring coming on, that we can be outside in our own yards. I mean, it's sort of funny to say, but we can't catch it from ourselves, right? So if you live by yourself, you don't need to re-sterilize your doorknob as long as you're staying in your home, for example. And even if you have some of those other comorbidities, you have to actually get it from someone who has it. Beth, here's a question from a resident of Bexley. My father is 74 and lives in the condo building downtown. I would like him to come stay and live with my family for the duration of the pandemic. What's your opinion on him leaving his setup and coming to our home? Is it risky for him to do so?
Well, a lot of that depends on what the other people in the household, what their situation is. So if someone in the household is leaving the house and going to work every day and is around other people, then that's going to just expand the circle of contacts. You think about it like a spider web going outward. So if the 74-year-old moves into a household and within that household, 4 people are then connecting with 4 other people every day, I think that sounds more risky. I would say that the ideal situation is if that person's able to stay in their own living situation, but get lots of touches from phone calls and food delivery, and has a way to support them. That would be the safest thing to do. I think anytime you bring someone who's elderly or older into a household that has young children or parents that are still working, you're just going to increase the number of contacts that they could potentially have with the virus. Now, I will say that I gave this same advice to someone, but I made it clear that if you have an elderly person who's in a living situation where they don't have that support, where they don't have an ability to get the right groceries or get their medicines or get to the doctor if they need to, then yes, that person should come to stay with you. But if they're in a good spot where they are, I would say.
Okay, sounds good. The next question here is for either Beth or for the dog just knocked over my screen there. But he's very cute. For either Beth or Abby, 2 questions. One, for children who divide their time between 2 households, are there additional considerations for precautions other than washing and sanitizing? And the second one is, are children under the age of 1 considered higher risk? So either Beth or Abby or Dave, I mean, anyone who would like to answer that question.
I can answer the first one. Beth, I'll let you answer, or Dave, the one about the children under 1. So the first question relates a lot to things that Beth just said about bringing an older person into your house. So the point of the stay-at-home order is to reduce your exposure to other people. And that just means in all the ways that you have control over your life, to reduce the number of people that you interact with on a regular basis. And within that, we all have to live our regular life. And so if children go back and forth between 2 parents' homes, that's their regular life. And you have to take effort to minimize the number of exposures that those kids will have in those wider circles. You have to continue to wash hands and take care when people become unwell. But there isn't a reason, barring underlying comorbidities of other people living in the house, there isn't a reason, for example, to have children stay only in one household for the next 3 months. If people are generally otherwise healthy, they have to figure out how to balance those risks with the benefits of being with family and maintaining regular schedules for kids. If the question had been, you know, my next door neighbor and my kids are really close and they've been used to spending a lot of time together and they love to play in our yards, and, you know, those kinds of exposures are much more in the control of families. And my recommendation and understanding of the literature right now is that those are the kinds of things we do not want people to do. It really is encouraging people to stay within family units. There will be time later to rekindle those friendships and really take every effort that you can for yourself and for your children to restrict engagement with other families. Think about it as a sort of familial monogamy internally, and reduce exposure to other family groups so that it ends quicker and we can all go back to the normal ways of interacting.
It's sort of funny. One of those sort of memes that was going around Facebook, it says, you know, our grandparents were called off to war. We're being called to sit on our couches. You know, we can do this. When you think of people who lived in a lot of our homes and, you know, teens and the, you know, 1940s, their families might have gone off to Europe for 2, 3, 4 years to fight and to, you know, be in the winter. And we're basically being called to watch Netflix for 2 months. You know, it sucks. I mean, it does, but it's not in the grand scheme of humanity as horrible as it could be, and sort of leads us into the next question here. Maybe we could each sort of take a turn with this one. What do you recommend for exercise in the current climate of COVID? I'll answer for myself is that I'm exercising every single day, and I'm alternating that between jogging. We have a stepper here. You know, I've been riding my bike outside. There's some online sort of classes that I've been doing. Beth, Dave, Abby, and you know, Ben and Jen, I mean, what are you guys doing for exercise? I mean, honestly, keeping yourself sane in this age, to me, it has to be, even with the 18 hours of Netflix, you got to do at least 30 or 60 minutes of exercise every day.
Well, I saw the questioner, and this questioner will not be surprised to learn that one of my major routes of exercise is home improvement projects. So those are continuing. And especially in the evening hours, it's a lot easier with a lot less public meetings happening in the evenings and community meetings. And also hiking. I mean, I think hiking in areas where it's low density, where there's lots of room and you're not in a situation where you're within 6 or 10 feet, much less 2,000 feet of other people. There are lots of great hiking opportunities in Central Ohio. So that's my own personal routine.
We've been walking the dog. We have literally, as every other dog in Bexley, our dogs are so spoiled. She actually barks at the bottom of the stairs now every night when we go to bed because she can't stand being alone because we are with her so much. So really running, walking, doing yoga, whatever you can do to keep yourself sane. And we can all do that.
And I would just add to that one as well, Michael, is that, go ahead, Abby, I'm sorry.
No, you go.
Is that with the healthcare workers, you know, in the hospital where we practice, we've recognized how important wellness is because, you know, the healthcare workers, the nurses, the pharmacists, the technicians, the physicians, the nurse practitioners, they're all working incredibly hard during this process and obviously putting, you know, themselves at some personal risk as well. And so we've recognized how important that is for them. And so focusing on wellness in that community, and that translates to, you know, personal wellness as well. It's really every single thing that we need to do needs to focus on the fact that it's scary, what we're hearing in the news, what you're living day to day. And so whatever you can do to get your mind around it, whether it's home improvement, whether it's physical exercise, whether it's trying to drag your dog out for the 8th walk of the day when she's not very happy to do that anymore, But do something, I think, that takes your mind off of where it may tend to go otherwise. It's just so critically important.
Yeah, I can say on a personal note, and I mean, not to be melodramatic, after 25 years of emergency medicine, this is the first time that I've been scared to go into work, not only for myself, of course, but for our family. And so that wellness time and the exercise time is super important, whether you work in healthcare or whether you're volunteering in Bexley or whatever job that you're doing. So this is tough stuff, and it's not fun for me personally, again, wearing a N95 mask and figuring out, who I need to be completely gowned up for and who not. And so these are difficult times for everyone, but the exercise and the wellness is super important. I know we haven't had everyone's exercise routine described here, but I just move on. There's 3 questions here. Dave, I know you riding your bike in France is one thing that you like to do sometimes too, right? But the 3 questions here are all involved around testing. And Abby and I know we spoke about this earlier this afternoon. Now that more testing is available, when are we all going to be able to know, not just people with symptoms? Once things have calmed down, can we test healthy individuals to see if they've been exposed and they have a lower risk? And another question regarding testing, if you've had it, when can you get it, even if you've been asymptomatic? So, I mean, it really speaks to, the fear in the community, and hopefully, and just my own sort of plug, expanding on what Abby had said, as far as the social distancing stuff, it's hard, and it's hard making your kids not hang out with their friends. But it's super important here. Abby, do you want to field some of those testing questions?
Yeah, I don't know when it's going to be possible for all of us to be tested. So I'll have to defer to someone else on the panel who's a little bit closer to the clinical realm for when those will be available. I can speak to something else important about testing though. So like the questioner mentioned, there will be 2 types of tests, at least 2. One will be expanded availability, like with rapid tests that mean if you come in and get the test, you can know within 15 minutes or 45 minutes if you have COVID-19 right now. And there also are in development, including pretty far in development, tests which measure antibodies, which show for people who have recovered that they have ever had COVID-19. And both of those things will be important for the goal of public health right now, which is mitigation. So knowing when someone's infected, when they're infected, so that they can stop transmission to other people, and also knowing after someone's been infected, if they're presumably in this period of somewhat reduced risk of reinfection, they're in this period of brief immunity or extended immunity, we don't know yet. But the reason why the testing matters so much, and why we will know more when both of those kinds of tests become more available, is that we really have no good sense right now about all of the cases that are so mild that people have not gone for testing. And one of the wonderful consequences of having more testing is that we'll have a much better sense of the number of those mild cases, and it's going to make a lot of the numbers that scare us the most right now look a lot better. So there was a paper published today in the Lancet, which showed that the death rate overall from coronavirus was less than 1% if you made an estimate of the number of cases of people who hadn't been counted, whose infections had never been counted. So it's higher, and Michael showed this earlier on a slide. I think, it's 2% or 3% or even 4% in some sites, in some places that the death rate is so high, but the actual death rate is much lower than that if you were counting accurately all the people who have been infected but haven't either gone for care or haven't actually been tested. So we're all, I think, both on the measurement side, on my side, and on the clinical side, looking forward to the time when we're going to have more availability of tests. And it is increasing every day. It's not at the level that it needs to be, but it is increasing all the time.
Beth, you had expanded on this just a little bit, but here's another question. How long is the virus expected to live on surfaces, and do disinfectant wipes kill the virus if you wipe off things that you bring into your home?
Disinfectant wipes definitely kill the virus. I'm going to speak to my limited knowledge about what studies have been done about this, but the only one I know of was in the New England Journal, where they tested how long the virus lived in sort of a fabricated way. They sprayed the virus, I think, in a lab, and then they sort of measured how long it lived on the surfaces. So it wasn't a real life situation, but they thought it lived on cardboard, for example, I think was, less than 8 hours. But the plastic was what got people concerned, where it was up to 3 days. And of course, we have a lot of plastic in our lives, don't we? So, but then, again, these were virus particles that they could measure. What we don't know is once they measure these virus particles is actually how infectious are they? Because the particles are just particles, and they think that because of the way they measured it, that these aren't actually quite as dangerous as if you got that particle from a person who coughed or sneezed on you. Like I said, it was a fabricated lab, and they published this result quickly, of course, because we all want information. But again, this was a small study. It was published in the New England Journal, so it was an important study, but it didn't mimic real life situations. So really what we're looking at, if you found a particle on a piece of plastic in the second day, would that be infectious? They think probably less than 1%. So to answer your question, yes, wipe everything down because we all feel like we want to do something to decrease our risk, but your risk of getting something from a surface is much, much less than getting it from some other person.
Here's a question that anybody can answer, of course. Dave, I could sort of direct it towards you. I know that there have been different folks in the community who have done good things. There's been, folks who have dropped masks off at our home. I know Drew Flora made these plastic boxes that you can actually use for intubating patients to decrease some of the droplets that would potentially go to a healthcare provider when they're doing that, and just showed me pictures today that we're going to actually start using in the emergency department. But the question here is, how can we best support healthcare providers? What can the Bexley community do for healthcare providers in our community?
Yeah, it's a great question. The community at large has really rallied in Bexley and again everywhere in trying to support the healthcare workers. And as I said before, I think a lot of this is just the innovation that comes out of the concern that everybody has in trying to make sure that we are taking care of ourselves, taking care of each other, and taking care of our community. And so people have brought food, to healthcare workers. Everyone appreciates food here and there, and there's no preclusion for that. But I think that the important thing is that when, people talk about masks, if there's a need for a mask in your own family, and that's controversial right now, the, Centers for Disease Control and Prevention, yesterday, the director made a comment that maybe masks in the community is where we're going to head to. And so things are changing really rapidly. But, if you have a stockpile of masks at home, drop them off at your local nursing home, drop them off at a hospital, give them to a healthcare worker, because there is definitely a shortage of the protective equipment that we're going to need. Today we're fine, but when you project out another month, as these numbers begin rising, there is going to be a shortage. And so I think that's one way that we can help. And I think, again, it's going to sound like everything we've talked about before, but the best thing that the community can do is to keep physical distance from each other, and just to think about your family as you're being your nucleus. Outside of that, just take a pause. And if you have COVID-19 and you infect 3 people and they infect 3 people, you can think about how this spirals. And so the most important thing you can do is really just to minimize the chance of transmission. Be smart about this. Wash your hands often, minimize the chance that you're going to infect other people or yourself as well. So I think those are really the things. And, there's a variety of opportunities for donations across the city for healthcare workers as well. And you can look up on the Ohio Department of Health has locations for where donations can be given. And if you're a vendor that has a product that you think might have applicability, there's also opportunities where you could actually, as a potential vendor or as a potential supplier, communicate with hospitals about what product you might have that could be innovative and help deliver care.
Yeah, I think those things you see on Facebook all the time with the ER doctors and ER residents with the signs that says, we are here for you. Please stay at home for us. And when you say, what can you do? It doesn't seem like you're doing much sitting on your couch, but that is probably the most important thing. However, as Ben talked about earlier, there are opportunities for volunteering in Bexley. There are ways to give, obviously charitable organizations. Certainly, there are, just support, calling your, your parents, grandparents, making sure people are still able to be, kept in touch with, are all super important things to be able to do for each other, which is important. And then those extra masks, I saw an estimate 3.5 billion masks will be needed worldwide by the time coronavirus is over. So, I mean, that's just an unbelievable amount. So even if we had anticipated, it'd be hard to imagine meeting the need for such a huge amount of protective gear. So one other question here just came in. It says, is it safe to donate blood? I know the supply is low. What precautions would need to be taken before you go to donate blood?
Well, I'll tell you this, my son and wife donated blood today, and it is safe. They mentioned that the workers at the donation area were wearing masks. It's really critical. Blood supply today is good, but again, with illness that increases, it's going to be a shortage. And that's a really important point, Michael, is that giving blood is still critically important at any time, but certainly I think now is especially important.
Yeah,
I also want to mention, that we have a community blood drive that the Bexley Public Library had arranged before all this happened. We're trying to make sure that we can do that safely. If we have to change anything, we'll let people know, but keep an eye on the blast and on Facebook for some more information about that coming up.
The other thing I was just sort of thinking, supporting local businesses. We have, residents of Bexley who own businesses in Bexley, and, supporting those businesses, whether it's getting takeout with restaurants or other ways of folks that are open, is a nice way to support the community. Ben, I don't know if you're able to field this one, or Jen. It says, if the peak of the virus is early May, how did the schools pick May 1st as a possible return to school date? Any idea about that?
I think that we're taking timelines with sort of what's the best case scenario. Let's plan for that in terms of timelines. And then as time gets closer to when that timeline ends, let's see where we're at as a society, where the health risk is, and then plan accordingly. So I think there are a whole lot of models out there, and the public health experts can talk more about that. The next couple of weeks are going to be incredibly critical. We're going to know a lot more at the end of April than we know right now. And so this is the current plan. And I think policymakers are going to talk to public health officials and to the medical community and determine how to best move forward after that date.
And I think it's important just to echo that we are all following what the governor lays out. I don't know that the schools really had much say in when these dates were being picked, but if the governor is going to tell us that we need to stay out of school until May 1st, then as Ben said, we'll do it till May 1st, and then we'll see what happens then.
Well, we've been doing this for an hour. We've covered just about all the questions. I shouldn't say all the questions, but we've sort of compiled some. I think the very last one here, let me just scroll down just a little bit here. And maybe Abby, you'd be best prepared to answer this, but we think that if we can quarantine for 2 weeks, we're okay, right? So there are folks that have been self-quarantining. You take the dog for a walk or you go for a jog, whatever. Basically, you've been with your family unit for 2 weeks. No one has any symptoms. Does that mean that we're sort of out of the woods ourselves as far as another family down the street that's also been self-quarantining for 2 weeks? Or is it really impossible not to have cross-contamination with some of these things that Beth was talking about, you coming back from the grocery store, or anything that any of us would do, just being around anybody that we know, or family members, or, families with two different parents, that kind of thing. How do we get out of this? I think might be a nice way to sort of end this. I know there's a firm, easy answer to this, right?
Yeah, I mean, I mean,
we've been doing a good job, hopefully, and Amy Acton and DeWine, but where are we going?
So a couple answers about that. So the first one is the scenario you laid out is exactly right. It's really hard to have zero exposures. So even if your family has done 14 days inside your house, someone's most likely gone to the grocery store or spoken with the postal carrier, or had some, or one person's gone to work, so, had some level of exposures, and same with the other family. Even if you've managed to be 14 days inside, there are a lot of families in our community and in Ohio that don't have the ability to live that way. Their jobs are essential, or their lives require them to be out and about. So think of your family as doing the work for your own family and someone else's, and really cutting down on your social contacts. You're cutting your R naught to zero if you were to be exposed, because someone else doesn't have the financial or logistical resources to be able to do it. And it does mean we're going to go on for a while like this, and it isn't clear epidemiologically or any other on any other axis, like when is it enough that we'll be able to stop doing it? There's a lot of people looking at that right now. The main answer is not yet. But I do want to say something else. Public health is a very prevention-oriented discipline. And I have been thinking about something else that I think all of us in Bexley should begin to think a little bit about, which is when we first were doing our, stay at home, not exactly quarantine, but sort of extreme social distancing. I think a lot of people thought about what they wanted to have in their house. If their kids were going to be home, how would they stay entertained? Would they have enough to eat? I encourage people at this point to begin thinking a little bit more about how their household would operate if someone gets sick. So, as this curve of cases begins to increase, we'll have more cases in Bexley, including among people who are taking all the precautions that people are recommending. So think about your house, think about where a sick person would sleep, think about what bathroom they'd use, how will you manage the laundry, and what about washing dishes, what kinds of things would allow that person to be safely isolated in your home and for the rest of the family to stay healthy. Maybe that means you need a different childcare plan or a backup plan. Maybe there's an older relative you take care of and you need to have a plan B for that person. Just thinking about some of the logistics so it's not an emergency. We all have to get ready for there to be some cases close by to us. And if it's not us, it might be our neighbor, and we might need to help out that person as well. So now is the time when we don't have as many and then we're not operating in a panic mode to kind of think about the things that we need to have in our own small spaces to make those moments more manageable when they happen.
I'd also like to say, to add on to that we're looking at a situation as this drags on and as the peak happens in May, that we have obviously always extremely vulnerable populations in Columbus. So I would encourage everyone to think outside of Bexley. What can we give to this city? We were talking about housing insecure people in the shelters, food banks. There's going to be a lot of needs in our city in the next 3 to 6 months, and lots of things are going to change for those resources that are generally reliable. Some of those are going to go away. So as a community, I'd love it if Bexley could really start thinking outside of our wonderful small bubble that we live in, and to start thinking how we could add back into the city at large.
That's a great point. We have obviously so much to give. So that's probably a great way to end this. I mean, we're all sort of going to be there for each other, if not physically and 6 feet close to each other. We certainly need to be looking out for each other in this way. So you can sort of see that was a lot of the questions that have come in, as well as this great expertise that we have on this panel. So closing thoughts, anybody?
I just want to thank all of our panelists today. You guys, it was so great to have you here. Thank you for putting this together, Jen Robinson, and for our experts on the call. I want to thank, we have a COVID-19 task force that is comprised of public health professionals, but also charitable organizations, the schools, religious institutions in Bexley that has been doing a whole lot of work on an almost daily basis, helping to coordinate the community's response to COVID-19. Please visit, I see a couple more questions that have shown up recently. Bexley.org/coronavirus. We do provide stats so that there is some information about what's happening in the community. I'm going to piggyback slightly off of one of the questions, which was a lot of those stats are lagging. I mean, we're getting information from tests that maybe were taken about a week ago. So it's really hard to tell exactly where those positive tests come from. But what we need to remember is just to take all of those extra precautions that we've been told about. Dr. Mike Weinstock made a great point earlier, which is we can do this. I mean, we have not faced an issue at such a large cultural scale in a generation, but we are a generation that can tackle this, and we're a community that has the resources to do so, and to do so with grit and determination, and to do so in a way that helps the communities around us as well. Don't relax. I want you to relax and don't panic, but don't relax, and that the measures that we have started to really learn well, how to social distance, how to wash our hands frequently, how to not have to shake everybody's hand. That was hard for me. Those are things that are going to be very important in the coming weeks. And so we have to continue to practice all of those best practices. It's going to be a tough few weeks. It's going to be a tough few weeks in our country, in our state, in our community, but we can get through those few weeks. And let's hope that we will do so successfully in a way that makes it not drag on for months. And the key to that success is, again, practicing safe social distancing, staying at home, practicing all the things that we learned on today's call. Reach out, volunteer, find ways to help your neighbor in a safe way. Those are the things that are help us get through this in the best ways that we can. So thank you again to all of you who participated. Thank you to our panelists. Thank you, Dr. Mike Weinstock, for your fantastic moderation of this. And I hope that you guys all have a great and safe evening. And I will see you around at some community events, hopefully later this summer. All right. Thanks, Bexley. Stay safe.